Okay, so good morning, good morning. Thank you for joining me.
Good
And
morning.
today I want to introduce Dr. Jones. She is both an integrative and functional medicine doctor, and she's also a specialist in pain management. She attended the university. She studied for her. She got her undergraduate degree at Fisk University. She attended Doctor of Osteopathy at Des Moines University in Des Moines, Iowa. She did a year of anesthesia training at the University of Illinois. She did her residency in physical medicine and rehabilitation at Loyola University. She did a 7-month fellowship in hospice at the University of South Florida. She did pain management fellowship at the University of South Florida. She also did research in pain management at the University of South Florida, and she trained in integrative medicine at a fellowship at the Andrew Weil program in Arizona. She has completed a certification in functional medicine at the Institute of Functional Medicine. Welcome, and thank you so much for joining me today. I'm so excited about this interview. You have so much training and you're so specialized and you're such an expert, and you're such a rarity in our field. You're like what we call a zebra. And we're so fortunate to have you. I wanted to just make a statement about why I'm doing these interviews. It's a series of interviews, and I hope to have this published more towards the beginning of the interviews, because there are so many people suffering from pain. There are so many people of color or melanated people who are being affected. I would say many people are being affected by fear because they're not sure what to do. And I feel like we need to help people figure out what they can do to prevent the virus, and try to avoid getting sick. And then if they do get sick, to have some reassurance that most people can overcome this virus and do okay. So I'm going to ask you a few questions.
First of all, good morning, everyone, and I'm happy to be here to share this information with you.
Thank you so much. Thanks for that. So have you been seeing any patients, or do you have knowledge of seeing any patients who have symptoms of the virus or who are concerned they may have the virus?
Well, most of the patients that I've been dealing with don't understand the virus. They don't have the symptoms of the virus, and they don't understand what's going on with it. So I try to explain as much as I can to them and tell them how to protect themselves from the virus. I do feel that all of us are going to get the virus, but it depends upon your immune system and to help you fight the virus, the symptoms of the virus.
Mm-hmm.
I try to explain that to them, and I give them, tell them things to help them with it. I deal with a population of pain patients who are resistant. They don't want to listen to what you're saying. And I think that the more I tell them, repeat the same information over and over, then eventually they'll get it.
Mm-hmm. So it's kind of like the population is in school and they need to learn a little bit more Is that what you're saying?
Exactly. They're hearing what's on the television. I don't know if they're reading it, and I'm sure they're seeing things on the computer, but I'm trying to help them put all of that in place for them.
Mm-hmm, mm-hmm. So what should our patients be doing to prevent getting or avoid getting the virus?
Okay, like I said, I think we're all going to get the virus, but it depends on our immune system as whether or not we could fight the symptoms. I deal with pain patients. Chronic pain is a real big problem because you're more susceptible to COVID-19 if you're a chronic pain patient because your immune system is compromised. You have inflammation. You usually are obese or overweight, have joint problems, pain in the muscle, and all of these things are inflammation, and inflammation reduces the immune system. So I have to talk to the patients about that. They're taking medication. Fortunately, I've gotten most of the patients that I see on a minimal amount of opioids. But some of them are taking the NSAIDs, which include ibuprofen, which is the same as Motrin, naproxen, Aleve, and the diclofenac sodium or potassium, Advil, and they cannot continue taking those because the virus likes those. It attacks the ACE2, which is the angiotensin converting enzyme, which is in the lung, and the virus attacks that. And so they need to be off of the NSAIDs to help them. The AC, if the virus attacks the AC2 enzyme, it decreases the signs of detecting infection. Acetaminophen, which is Tylenol, has a lot of, you can take it and you cannot take it, but if you take it, limit the amount you take a day. No more than 3,000 milligrams a day. I would try to keep it around 1,500. But whatever you do, come off of the NSAIDs.
Mm-hmm. Just let me stop you for a second because you've given a tremendous amount of information right there, and I'm going to break a couple of things down.
Okay, good.
So we're saying that, or you're saying that their immune system, the immune system of someone who has pain and who's taking medication for pain, is already at a disadvantage.
Yes.
Right?
Yes.
And you're saying that they're at a disadvantage because they have chronic inflammation.
Right.
Do your patients understand what inflammation is?
No. They tell me I'm not inflamed. And I try to explain to them you are. That's why you're swelling up. The obesity is swelling from the foods you're eating. Mm-hmm. Your joints are inflamed because of what you're eating. Mm-hmm. Your spine, all of these things are a result of what you're eating, and you are inflamed. So I think if I keep telling them this, they'll eventually understand. Yes.
And that is why they have pain, actually.
Right, exactly.
Mm-hmm. And what the advice that you're giving seems to be specifically for the people that have pain that are on medication for pain.
Right. But I also see a lot of patients that I've tapered off of all the medications.
Okay.
And they're still in, they're not really in pain that much anymore. So they were taking NSAIDs. Mm-hmm. And I'm telling them now to stop the NSAIDs, to take Tylenol, but at a limited amount. And some of them are okay with that. Mm-hmm, mm-hmm. I put the patients on duloxetine or Cymbalta to help with the serotonin and norepinephrine receptors. Mm-hmm. And that quiets a lot of it down. Mm-hmm. Some are on gabapentin, but at a very low dose, maybe 100 milligrams 3 times a day. Mm-hmm. And these things are helping calm down their pain. while we work on other things, such as increasing their activity, physical therapy, aquatic therapy. Walking is great for them. And I tell them, if you can't walk far, walk as far as you can, come back home and sit down, and then go back and walk it again. Eventually you'll get up to the corner. And
are you working on nutrition?
Oh yes, I tell them about try to take sugars. You don't want sugar in your diet at all. Stay hydrated. Try to stay away from gluten, such as oatmeal, cereal, potatoes, rice. And it's amazing on the number of people who eat oatmeal and cereal. Another thing is to stay away from the dairy products, to use products that are more coconut based, coconut milk based, or almond based, cashew based products. I recommend, to help increase the immune system, taking garlic, drinking water with lemons in it, apple cider vinegar, fermented vegetables such as sauerkraut, miso, coconut kefir, kombucha, kimchi, pickles, sprouted foods, organic green juices, fresh herbs, rosemary, cilantro, thyme, oregano, and stay hydrated. All of these things will boost the immune system. Then I like to talk to the patient about self-care, to practice breathing. There are a number of websites that they can join for free and download the applications to their computer. Calm is one. It's being advertised on television. Breathe, Meditation, Sleep is another site, and Headspace. Maintain physical health. Set boundaries. If you protect your energy, if you don't feel like talking to somebody that day, don't talk to them another time. You don't want to talk to people who are going to stress you out like the television is doing. Sleep, turn off the cell phone, dim the lights, and use calming oils such as lavender or chamomile to help you sleep. And then I also recommend probiotics to help with the gut flora. And then move your body, walk around. You could do yoga flow, which there are many programs on the internet now, and they help increase the lymphatic system and oxygen flow to the cells. And then finally, we come to the supplements. And the supplements that I would recommend.
Let me interrupt for a second, because you gave a lot of information. You gave a lot of information, very good information. So on nutrition, you mentioned fermented foods.
Yes.
And how do fermented foods, and talk about sprouted foods too, how do those two foods benefit people that have pain?
Well, from what I've read, they help with the gut flora. And they also help with, I'm not sure what else they do besides that. Can you offer that information?
I'm thinking that it's mostly the microbiome.
Yes, in the gut, yes.
Fermented foods. And then
same thing with the sprouts.
Okay.
Like, what is it? What are the names of the sprouts?
Well, alfalfa or broccoli.
Alfalfa. And there's another one that I like, but I can't think of everything right now. Yes.
Broccoli, clover. Actually, I was talking to somebody yesterday about sprouts are good for people to be doing now while they're kind of like confined inside, but they have a window. They could be, you don't need soil to sprout seeds like that.
Right, exactly.
Yeah. You can make sprouts yourself in a mason jar, look it up online how to do it. You just need the seeds, which you can order from Amazon.
Yes.
Hmm.
Yep.
But those are nutrient dense foods.
And like I said, they help increase the immune system and increase better gut health.
Yeah, and they're anti-inflammatory.
Right.
Uh-huh.
Yes, exactly. All of the foods that I listed are anti-inflammatory.
Mm-hmm, mm-hmm. So, with the breath work, how does that help people that have pain? Because I can see a lot of people wondering, how is a breathing exercise going to help me?
Okay, when you do breathing, you're breathing in deeply and then you're exhaling all the air out. And you try to make yourself focus on that breath. And eventually it becomes natural to do it. And then it takes your mind off of your pain issues. And we call it mind body medicine. So the breathing helps you focus on other things, and then it helps you with your pain. And it's helping increase the immune system as well.
Yeah, and I would comment on that because I have some expertise in autonomic nervous system function. That's the automatic part of your nervous system that works regardless of whether you think about it or not. That part of the nervous system contributes to pain, right?
Yes.
Hmm.
And
And
so
so,
it calms it down. It causes that,
down.
calms it down, yes.
Hmm.
Keeps it from firing so much. And it also helps with the cortisol levels.
Hmm.
And then you go from there.
Yeah, so that can be really, really beneficial to people. It can also lower their blood pressure
Exactly.
and control their heart rate more, right?
Right. And then, if you have a problem with obesity, it helps you focus on not eating
Mm-hmm.
so much. I found that if you drink cinnamon tea with
Mm-hmm.
the stick in it and an organic tea bag, it helps take away your cravings for food. You can set certain times of the day that you want to eat, and this helps you decrease the amount of food you're eating. And then that'll help you lose the weight.
Wow, I didn't even know that.
Yes,
Those are great tips.
yes.
I love cinnamon, and I recently heard about cardamom too.
Oh, cardamom.
Yeah, that cardamom works kind of like cinnamon. So you
What
can
is cardamom?
cardamom, it's
Yes.
also a spice.
Oh, okay.
Yeah, and it comes in white and black, and you can get, when you drink chai, that's
Yes.
one of the main
Okay.
spices in chai.
All right.
Smells so good. So, so then you also talked about probiotics, which
Right.
we talked about the fermented foods, but do you recommend certain probiotics?
Well, I myself take Megaspore, which is a bacillus, and I also take Saccharomyces.
Mm-hmm.
And I needed that balance in my genome bio microbiome.
Mm-hmm.
So I take both of those, and I do recommend that patients take them every day,
Mm-hmm.
and it will help with helping increase the immune system.
Mm-hmm. I also take the Megaspore, and I occasionally take Saccharomyces. It depends on what's going on, but that one helps decrease the number of yeast. And if you have a lot of stress, or if you've been eating sugar, then the yeast can kind of start rising up. Yeah, or if you're exposed to mold.
Yes.
Mm-hmm.
And I am exposed to mold, so I was told to take the Saccharomyces, which I do, and it really does. I could tell the difference.
Mm-hmm. Mm-hmm. Some people, they're finding now that some people can do okay or don't need as much of the probiotics. What do you say about that? They're saying like that people need to eat more fiber and prebiotics.
Right. They need other, and that's true. You need more fiber, which would be like fruits, vegetables, um, and then that will help you. I do need more fiber, so I take fiber supplements. And but you should try to get that from your diet.
Yeah, I was talking yesterday on one of the conferences that I did, or one of the seminars like this, and I listed out the different fiber sources from food like flax and psyllium, and in potatoes, like cooling potatoes after you cook them and putting them in the refrigerator and then reheating them creates more fiber
Oh, that's good to
in
know.
the potato, if that's what you're eating.
Yes.
Yeah, so people probably can look up like online, like sources of fiber, because Americans don't get enough fiber, right?
Exactly.
Mm-hmm. And then for exercise, what are your favorite forms of exercise? Because I know I try to prescribe a lot of mind-body exercise so people can get multiple benefits. What are the ones that you favor? I know you mentioned yoga flow.
Right. Yoga flow, which you can do online.
Mm-hmm.
I recommend walking. You
Mm-hmm.
do not have to do intensive exercise in order to boost your immune system.
Mm-hmm.
It can be moderate, suit for you
Mm-hmm.
and what you like to do. I myself walk, I do yoga and Pilates, and I'm getting ready to start doing spinning. But
Mm-hmm.
it depends on you, as long as you're doing something every day, up to 30 minutes a day.
Mm-hmm.
And I think it boosts your immune system. It helps with mind body. It helps with pain issues. It helps with obesity, inflammation, all of it.
So are you getting the spinning machine for your home?
Well, no, there's a new center coming here that I want to start going to.
Oh, okay. Okay. Yeah, I might try that. Also,
Yes,
it's become very popular. I used to do it a lot when I lived in Chicago.
I did too when I was in Florida. I used to do it every morning.
Mm-hmm.
And a place is opening right across the street from where I live.
Can you talk about the supplements that you recommend? Because
Okay.
my next question was about how people can improve their chances of survival if they get the virus. And you're probably going to talk about some things that prevent, some of the supplements that prevent or help your immune system, right?
Okay. There are basic ones to take. I would recommend vitamin D3, 5,000 IU daily, which is the way it's given. Vitamin C, 1 to 3 grams a day. Zinc, 15 milligrams to start with, 2 a day. The probiotics, B complex. Then you can add on omega-3, 2 tablets twice a day. And then after you start these, then you can start building up to curcumin and the other anti-inflammatory supplements.
Okay.
But these are the basic ones that patients should start with.
Okay. And who should not take, it sounds like maybe 4 grams of omega-3s?
People who are on blood thinners
Mm-hmm.
should not take omega-3.
Mm-hmm.
They should, because it'll thin the blood out too much. But
they can probably get it from food, like eating sardines a couple times a
exactly,
week.
sardines and salmon.
Mm-hmm.
But we don't always have levels of this in your blood,
Mm-hmm.
the vitamin D3. So I just recommend the 5,000 IUs daily.
And people are sitting inside all day now.
Yes.
So most people are going to need between 5 and 10 somewhere.
Right.
Mm-hmm.
But since we don't have levels of it,
Mm-hmm.
the blood levels,
Mm-hmm.
it's better to start off with 5,000 IUs daily.
Mm-hmm.
A good B complex, and go from there. There are other things, like I said, we can add on at a later date,
Mm-hmm.
but these are the basic ones right now. multiple vitamin, digestive enzymes, glutathione, or some other ones that we could add.
Oh,
But
when you mentioned glutathione, I'm reminded about the acetaminophen. So one of the questions that I had, because Tylenol or acetaminophen can kind of decrease your production of glutathione in the liver. And I know with the pain patients, it's kind of like you're trading, you're robbing Peter to pay Paul, because you're trying to get them off of opioids, right?
Yes.
So which one is, because I know what the answer is, but which one is worse, the opioids on your system or the Tylenol on your system?
I think the opioids. Yes. And then once we could get that together, the dependency on the opioids, then we could work on the other levels. But initially, I would use Tylenol, or maybe give a glutathione supplement with that, and then eventually try to get them off Tylenol. I talked to a few patients this week who were on the Tylenol, who were on the NSAIDs, and then they were okay about switching to Tylenol. And so when I talk with them again, we're going to talk about glutathione. So I have to go in stages.
And I think NAC is a cheap way to get the liver to boost glutathione production. Yes. Right? So if they're on some of those meds, they can probably take NAC to counteract some of that.
Yes. And
but the effects of the opioids are pretty significant on the immune system.
Yes.
It affects the gut and the nervous system and all that, right?
Yes. The neurotransmitters, the in the brain and in the gut, they affect gut flora. It's the liver, the kidneys, the whole gamut is affected by it. Yes. And it's not good.
Okay, I'm sorry to have interrupted, but I wanted to just get that point across, because
it's good. I'm glad. I like the fact that we're discussing things.
So I stopped you in the middle of the supplements. You were gonna
talk. Yes. Eventually you will need digestive enzymes, like 1 to 2 before each meal, which will help you digest the foods and help you get the nutrients out of the food that you're eating, and keep you from having indigestion.
Who is that? Who are the digestive enzymes for? Like because I know that's for your patients, because they've been on opiates and their digestion's messed up. Who else can that benefit?
That can benefit everyone, not just pain patients.
Because the digestive enzymes kill the virus in your stomach, right?
Yes. And then they need a multiple vitamin. The multiple vitamin may have a lot of these things in it, but it's not enough. So that's why we'd like to give you these other supplements separately from the multiple vitamin.
Are there certain multiple vitamins that you like, categories that you prefer?
Well, I like one that Pure Encapsulation has is called ONE multiple vitamin. And it's a good starter multiple vitamin, and it gives you a good energy for the day. Which ones do you like?
I generally tell people to look for the ones that are made from whole foods, that are made from fruits and vegetables, because those are kind of safe for everybody. I do like the one you mentioned, because it's easy to take, because it's like one capsule.
Right.
And they also have one, I think, called Pure Genomics.
Right.
Encapsulations. And that one's good for people that have issues with detoxification, methylation, probably some of your types of patients. Those are good for.
Yes. And then I recommend along the way, like I said, the curcumin, which helps with inflammation. I find that magnesium helps with, magnesium is a mineral in the body, and usually pain patients are deficient. So I like to give it to them to take at night, which will start helping to replete their deficiency and help them with sleep.
Mhm.
I do not recommend sleepers such as Ambien or all the other ones because it's not doing anything for you. It's just medicating you. You want things that will help you and restore and treat your issue instead of just medicating. So
Not only that, but with these breathing problems that people have with the virus, those sleepers are not a good idea at all.
exactly.
Hmm.
And then like we talked about the fiber, and then the B complex. And then women, especially women who have pain issues, a lot of them need a methylated folate. And I recommend that to them, like to take one a day. I usually like the ones that you can put in the mouth and it will dissolve there. That's equivalent to have the IV form of it.
So why more so women?
Women are usually deficient in methylation.
Hmm. And we need the methyl groups to detoxify estrogen,
Exactly.
the bad estrogens that cause diseases, right?
Yes.
Hmm.
So that's it. That's all I would give. I wouldn't, and then we go from there later after all this is done. We like to keep the cost down. And after we see how this is working for 3 months, then we go from there to see if we need to make changes.
What if people get the coronavirus? What do you recommend that they take?
Well, if they get the coronavirus, do not take any NSAIDs for the fever. I recommend.
I'm sorry to interrupt you, but the NSAIDs are what you mentioned before, like the Tylenol, Motrin.
No, the ibuprofen, which is Motrin, Advil, Aleve.
Okay.
The
Naproxen.
diclofenac products.
Okay.
Sodium or potassium.
Okay. Okay.
And then they're giving the Tylenol for the fever.
Okay.
I recommend you hydrate well. Let's see, the NAC, which is N-acetylcysteine, 600 to 900 milligrams twice a day. The curcumin. What else is there? Some more things.
Probably vitamin C.
Oh yeah, vitamin C, 1 to 3 grams. Those are, I already talked about those to help with not getting it. The same things you use to not get it or to help you increase your immune system, you continue if you get the virus.
Okay.
I do feel that all of us are going to get the virus, but it depends on the immune system if your symptoms, if you have symptoms or how great the symptoms will be.
Very good. Okay. And you're in the DC region. What's going on there? Like what's hitting the news in the past couple of days, or what are your concerns there?
Well, my concern is getting for people to realize and understand what's going on with this virus. Not everything you hear is what's really the truth. So you need to read. After you hear something, go read about it to get good information. The virus is increasing here. It's high in New York. It's increasing in the DC area, Virginia. So you need to protect yourself. If you go out, I do recommend a mask and wearing gloves. When you come back, throw it away. I mean, you need to take the precautions that they're telling you to take. But then you need to start doing things to protect yourself individually as well.
And when you're out, the social distancing is important.
Yes. Just follow all the parameters that they're telling you because they're telling you what to do. And then you add the other things for yourself too as well.
What are your concerns, particularly with people of color or melanated people in this pandemic?
Well, we are more susceptible. And that's why they recommend the vitamin D3 because we're inside, we're not producing vitamin D. So we need to take the supplement. We need to the the uh, the women have a better immune system than men, so the men need to really look at their immune system as well. Um, do you have anything else to add to that?
Well, I would just comment on, let's talk about the reason why Black people have lower vitamin D levels on the East Coast.
Because there's not much sun,
Mm-hmm.
and you need sun to help make the vitamin D3.
Mm-hmm.
And if you don't have enough sun, you don't have it, and then your immune system goes down.
Mm-hmm.
And that's the main reason. We need more than other people because of the melanin in our body. Yes.
Yeah, genetically, our melanin enables us to be in the sun longer and to tolerate sun. So they're saying now that we need 2 solid hours of sun exposure to get adequate vitamin D from skin production.
Oh, wow. Yeah.
Yeah, which most people on the East Coast, that's not even possible in the summertime.
Right. Even in the Midwest, I'm from Detroit, and we never have sun. It's always a cloud.
Mm-hmm.
So you need even more vitamin D3.
Mm-hmm.
But if you don't know your levels, then you need to just start at the 5,000 IUs daily.
Mm-hmm.
But you want a therapeutic level in your body to be greater than 50 and less than 80,000. Mm-hmm. 50,000 to 80,000. Mm-hmm. I see patients who is down to 1.
Wow.
I can't believe it. And nobody's dealing with
people in the single digits, but not yet 1.
Yes, 1. I said, wow, no wonder you're in pain.
Yes, yes.
And then some of the primaries will give vitamin D2. Mm. And vitamin D2 is not absorbed well. As soon as you stop taking it, you're down again. So that's why we tried vitamin D3.
Mm-hmm. I'm glad you mentioned that.
Yes.
And I'm glad you mentioned the pain, because as part of our pain workup, we're checking the vitamin D, because when you get below 30, level 30, you can start having pain. You can have it before that, because some people's bodies need to be at 45.
Right. So they need to be between 50 and 80. Mm-hmm. Usually around 80 for pain patients. The higher, the better. Yeah. But over 100,000, you can become toxic. Mm-hmm. So it's better to watch your parameters.
But they're showing in the research too that you have to get pretty significantly above 100,000 to be toxic unless you have liver problems. But we're not trying to push people beyond the toxic level.
Exactly.
But we just want to tell people that it's safe.
Yes, yes. Mm-hmm. But the patients that I'm dealing with, I have to start at very beginning. Mm-hmm. And try to educate them on what's going on. I wish I could have a class. Mm-hmm. And just have them come to the class so that we could talk about everything. Maybe choose one topic per class. Mm-hmm. But I'm trying to, every time I see a patient in person or telemedicine, mm-hmm. I try to educate them.
Mm-hmm. Well, now you see how easy this is. You can record classes on this
platform. This is nice.
And you can save the recordings, and then maybe where you work, you guys can have your patients watch it at home.
Yes, this is awesome. Thank you for having me.
So I wanted to mention that it's interesting that in the media, there has not been much discussion about melanated people and people of color. I did see the other night that Kamala Harris was on CNN, and she specifically mentioned that what you said, that we're more susceptible because we have higher levels of hypertension, diabetes, asthma, toxic exposures from environmental toxins, in our communities. So I'm wondering also with some of our behaviors, do our behaviors also cause us to be more exposed than we should be? And
yes.
Mm-hmm.
If we're having, if we're drinking,
Mm-hmm.
smoking cigarettes,
Mm-hmm.
doing that with the vape,
Uh-huh.
all of those,
Marijuana too.
not getting enough sleep,
Mm-hmm.
doing other illicit drugs, we're
Mm-hmm.
putting ourselves more at risk for the virus.
And particularly illicit drugs that you smoke.
Marijuana,
Yeah.
yes, yep,
Mhm. Or
exactly,
or smoking cocaine. Mm-hmm.
yes. I don't deal with patients who have substance abuse problems. I, but I do know that they need to be watched very carefully and take their supplements, I mean, take their medications the way they're told to take them so they don't go into withdrawal, because withdrawal can increase your inflammation and decreases your immune system even more.
Oh, wow.
Yeah. So you have to be very careful and follow what you're told to do.
Wow.
Yes.
That's very significant. When I think about it though, that makes sense that they're like when they go into withdrawal, they're in a acute state of inflammation.
Yes.
It's like a cytokine storm.
Exactly. That's
So they
exactly
would
it.
so they would have a cytokine storm, which would increase their ability to get the infection.
Exactly.
And then the infection causes a cytokine storm, the
Yes.
coronavirus.
You
Wow.
know what is interesting to me, that this virus is attacking the angiotensin converting enzyme too.
Yeah. Yeah.
That's in the lungs.
Yes.
And that's
Yeah.
very interesting.
So a friend of mine, Dr. Sue Fairchild, who I'm also interviewing, she's written an ebook in the past couple of weeks that she just published called Surviving the Coronavirus,
Uh-huh.
Surviving Coronavirus. And some of the research that you mentioned with the ACE inhibitor or with the ACE receptor, what I found out recently was that the people that are on ACE inhibitors, which a lot of people of color, people that are melanated, are on ACE inhibitors, or they may be on ARBs, and I'll talk about that next. The ACE inhibitors apparently cause the cell to express more of the ACE2 receptor.
Uh-huh.
So it increases the ACE2 expression on the surface of the cell. The ACE2 receptor is what the virus latches onto.
Exactly.
And the cardiologist will not make a statement on it yet. And I think part of that is because it would probably cause some panic because so many people are on it.
Yes.
And it's also probably because they don't have enough research on it yet. It's just preliminary research.
Mm-hmm.
But what I was telling people on some videos that I made on my Facebook page were that they should go and talk to their doctor about the ACE inhibitor that they're on and find out if there's an alternative medication or whether the dose can be decreased or something. But the ACE inhibitors are part of the cocktail that are given to patients that have diabetes or pre-diabetes. Mm-hmm. So they put them on an ACE inhibitor, they put them on metformin, and they put them on like a Lipitor or a cholesterol medicine that sounds like Lipitor. So that's the cocktail in internal medicine that people are put on. And we want people to understand that they can get off all their medications if they see a doctor like us, an integrative or a functional medicine doctor. If they seek out one of us, we can help them to get off those medications.
Exactly. And to decrease their chances of getting the virus.
Yeah.
Or we're going to get the virus, but having the symptoms that are associated with the virus.
Mm-hmm.
Yes.
So the people that are on ARBs, that's a different receptor mechanism. It's in the same family as ACE inhibitors, but it's a different mechanism. Those people, they said, might be protected from the virus.
Oh, okay.
Mm-hmm. they're not sure about it, but they said, so you maybe should not worry so much if you're on an ARB. But if you're on an ACE inhibitor is like captopril and enalapril, the ones that end in pril, those are the ones. Whereas losartan, that's the other category, so you don't have to worry about that.
Okay, yes.
Yeah.
But I'm wondering if the other physicians, other specialties know about all this.
No, we did a lot of research to figure this out.
Yes, and they're not, the patients that come to me, they do have a primary. I said, you need to see your primary.
Yeah, they need to go talk to their primary about it.
Yeah.
And then if their primary says, no, that's not true, maybe ask the primary, have they looked at some of the Chinese studies?
Yes.
Because the Chinese studies are out there, they're available. And actually, 2 studies just came out in Lancet this past week on the clinical course of coronavirus, looking at like the labs that, what we can see as indicators in the labs that somebody might have coronavirus or that they're going into the bad phase, like the lung phase.
Yes.
Yeah.
Well, there, that Panzatic, there's a group who puts out the information. It's a Chinese, Chinese naturopathic group, and they put out a lot of information that is from the Chinese research. And it's, only, I think it's difficult for lay people to understand, but we as physicians can get the information and give it to the patients. And that's what it takes time to study this and to talk with the patients and help them as much as possible.
And actually, my friend's book will help physicians if they care to look for it. Surviving Coronavirus.
Okay, yeah.
The beginning of the book has information that would help physicians that want to learn more about the molecular things that I mentioned.
Yes. Yep.
The cell receptors and all that stuff.
There's a lot of things that are unanswered and not proven yet. We as clinicians can only give the patient what we know from our studying and what is out there. Things might change from what we know, like the NSAIDs and acetaminophen, that might even change. But at this time, this is what we know, and we're trying to help the patient to our best ability.
Yeah, that's important to mention. I'm so glad you mentioned that because, if somebody sees this like a year after it's published, they really need to look at later information to figure out if the information here that we're giving is still valid or if it's still intact, because these things are moving on a daily basis. I mean, that's why most medical people are kind of exhausted, because we're having meetings every day online with these state organizations and national organizations to find out the latest information to give it to the people.
Exactly.
Yeah.
And we want to help as many people as we can. We want the patient to be receptive to receiving the information and try to implement it into their lifestyle, and that way they can be helped. So
one area that you briefly mentioned, but I want to just ask one more question about it before I forget. Going back to what people can do, what do you tell your patients about sleep? Because your patients have some of the most complicated sleep issues. And how do you, if people are having significant problems with their sleep that you know about, how are you helping them? What kind of diagnostics are you getting? Because some things can be done in the home now. So,
right. I tell the patients to go to their primary and have the primary do the studies for sleep apnea, and they can be done in the home. And then at the same time, I try to tell them sleep hygiene, turn off the cell phone and put it somewhere else. Dim the lights. Do not have any electronics in the room where you're sleeping. Use calming oils such as lavender or chamomile. Drink tea. Try not to drink caffeine after 2 o'clock in the afternoon. And to not to sleep during the day. Try to set the same time to go to bed and get up every day. Say if 10 o'clock, get up at 6 or 7 in the morning. And then that's better sleep hygiene, and that will help. And I also use magnesium, like I said, to help my patients sleep better. Usually we are deficient in it. It's a mineral in the body, and it can affect sleep. So I give them magnesium at night to take at 10 p.m. and you fall asleep right away.
And how many hours do you tell people they should be sleeping?
7 to 8 hours.
Okay. And what do you tell them about, what is circadian rhythm, and what do you tell them about that?
Okay, circadian rhythm usually occurs around 2 a.m. and it's good to be in bed at that time because all of your hormones are replenished at that time. If you do not have that, if you're not asleep at 2 a.m., you won't get replenished. People who work at night are not getting replenished, and therefore it causes increased cortisol levels. The patient's stomach gets bigger, and then it affects all the other hormones in the body, the thyroid, your estrogen, progesterone, testosterone, etc. So it's very important to be asleep at that time.
And you have to be in a certain phase of sleep at that time, right? At 2 a.m.
Yeah.
Because some people, when they hear that, they're thinking, okay, I can go to bed at 2 a.m.
No, I think you have to be in REM. Yes.
Mm-hmm.
Yeah.
So you need to be in bed a few hours before that.
Before that, yes.
Mm-hmm. Mm-hmm.
And you, the way you feel after getting that kind of rest
Mm-hmm.
will really help you. I try to tell my patients, especially the women who work a night shift, try to change the job during the day,
Mm-hmm.
if possible. They're exposed to the UV lights all that time,
Mm-hmm.
and that's triggering estrogen, increasing estrogen in their body, and a lot of them end up with breast cancer or uterine cancer. And that's very important not to work during those times.
And when you mention the UV light, are you talking about the blue spectrum?
Yes, the light, in the ceiling. Usually it's in the ceiling lights, and they're all ultraviolet. Yes.
Mm-hmm. Mm-hmm. And what do you tell your patients about 5G and about Wi-Fi?
Oh, okay. They need to limit that as well.
Mm-hmm.
Not to have it on all the time.
Mm-hmm.
A lot of times you need certain glasses to wear. I think it's the blue glasses to filter the blue radiation.
The blue blocker glasses.
Yes.
Yeah, back on the UV light, they block the blue light and they block the UV spectrum, the violet spectrum.
Yes.
Yeah.
And the computer, working at the computer a lot, can trigger seizures for a lot of patients. Mm-hmm. And so they have to be very protective of that. Yeah. And the computer can trigger your neurotransmitters where you can't get a good sleep. Mm-hmm. So you have to turn it off at I would say 2 or 3 hours before you want to go to bed.
Yes, that's what I tell people.
Yes.
And actually, I mentioned the 5G Wi-Fi because they are looking at the patterns of the cities that have a lot of 5G installed, like on the side of buildings where the 5G is going all the time, and the occurrence of the virus in these metro areas, because they're thinking there's some correlation.
Wow.
Yeah, that's new stuff coming out in the past couple of weeks.
Wow.
But we already knew that 5G was causing people problems.
Yes. Yeah, that's true. Yes.
Mm-hmm.
You have to look at your environment, all of that, all the chemicals. And another thing, the electrical cars can be decreasing the immune system,
Mm.
all of that. It's
Yeah,
really,
'cause I
really
guess
a
that
lot.
has a lot of electromagnetic radiation too.
Exactly.
Anything with electromagnetic radiation probably is not a good thing.
Exactly. So
Hmm.
therefore, you have to take, if you're exposed to all this, you have to do things separately to increase your immune system.
Hmm. Hmm. What do you say? Because I've seen on TV some melanated people, um, like at funerals or having parties or big gatherings at this time, still
No,
doing it despite recommendations.
right. It's not, they're, even though they don't have the symptoms, they are still possibly have the virus and they're giving it to other people.
Hmm.
I had a cousin who died, and I really wanted to go to her funeral. I asked them could they do it virtually. They couldn't. They had the funeral anyway, and it was 20 people there,
Oh, wow.
and that's a lot of people
Hmm.
for
Hmm.
the time of the virus.
Hmm.
So you have to be really careful. I saw in the news that there were 2 funerals somewhere in Florida,
Hmm.
and most of the people got the virus from the going.
Hmm.
So you have to be
Weddings,
careful. And
weddings.
weddings, yeah, and they were at the beaches, yes.
Hmm.
So yes, I
Hmm.
was at the park walking, and it got to be too many people,
Hmm.
and they closed the park down.
Hmm.
So
And I
yeah,
think you have to be careful anywhere you go because I noticed, like in Trader Joe's, they're only letting a certain amount of people in the store at once.
correct. I went, yes,
But I think people forget, like they kind of get involved in their shopping and they forget about keeping the distance. So
exactly,
you just have to be aware and keep the distance
yes,
and assume everybody has it, right?
yes, because they
Mhm.
probably do.
Yeah, they probably do. So is there anything else that I left out or that you wanted to talk about?
No, not at this time. I like to have a refresher as new information comes out. I like to be able to come back and present that to the patients or
Hmm.
to the audience so that they can be more aware of different things.
Hmm.
Not just that we're telling them everything to do, but for them to think about it and use things that can help them.
Yes, because I think if people just apply a few of the lifestyle recommendations that you make, maybe a couple or 2 or 3 of the supplements that you highlighted, um, that their immune system will improve and
Exactly.
that
Yes,
increase their chances of survival.
exactly.
Mhm,
Yes.
mhm. So thank you so much, Dr. Darlene
Thank
Jones.
you, Dr. Satcher. This was wonderful. And anything I could do or any questions, just let me know. I'm eager to help.
Okay, okay.
Okay.
All right. So
Okay.
I'm going to stop the recording.
Okay.